Hello, juniors. This is Professor Kaiser. I am going to provide you a short video with some more information on your teaching project. This time, I'm giving you a little bit of guidance on what you should use on your presentation. So remember that the teaching project has two parts. The first part is an individual paper, an evidence-based paper that you will write after researching the disease process you have selected. The criteria have been provided on the instructions you were given. The second part is a presentation. The presentation will be aimed at teaching your patients. So you will create some type of presentation method, whether it be a PowerPoint or a pamphlet, whatever you choose, you must make sure you are able to present to your class on the Zoom platform. So as I mentioned, we are going to be teaching patients with our presentation. So I'm going to provide you a few pointers with how to provide patient education. So for your health literacy presentation, the first thing is understanding what health literacy is. It's the ability of patients to understand, interpret, and provide care for themselves based on the disease process that they are living with. According to a paper I have read by Foster et al., approximately 90 million people in the United States have limited health literacy. So as a nurse, it makes our job of patient education very challenging, but also very important so that patients are able to care for themselves when they are discharged home. Patient education is one of the prime roles of nurses. In order to prepare a presentation for patients, you must take several things into consideration, and I'm going to review that with you on this brief video. So for the presentation, the purpose is to prepare patient education on the disease process that you have selected. After you've written your paper and done your research, you should be an expert in the disease process, at least more than a novice, so that you are able to educate patients if they come and see you with this disease. You need to make sure that the content is developed for the patients to understand, not your classmates. The presentation should be about 15 minutes long. Make sure that you practice before presenting on Zoom so that your group is able to meet the time limit. Use creativity, include pictures, include visual aids, engage your audience, ask questions. Asking questions while teaching patients is important to evaluate their learning. And then you're going to incorporate 3 health literacy principles, which we provided you on Canvas, the health literacy principles checklist. So please review that checklist. Some of the information that I'm going to talk about here today is included in that checklist, and that will help you to make sure that you have these principles included in your presentation. So for the content of your presentation, make sure you are using simple sentences. Minimal sentences with fewer words are less intimidating for patients, and they are more likely to read it than they are long paragraphs with a lot of information. So keeping our sentences simple and our text legible, including a lighter background with dark font, that makes it easier for our patients to read. Use minimal medical jargon or terminology. Make sure that if you do have to use medical terminology, that you define the terms that you're using so patients understand what they're reading. Provide specific examples. So make sure that the information you are presenting is relevant to the patient by giving them examples they may encounter in everyday life. Consider patient demographics. Of course, we teach differently to a child and their parent than we would to an adult patient. Cultural barriers that might be in play, and then their education level. Oftentimes, patient education is developed at an elementary age reading level. Although we evaluate our patients in the hospital for their ability to learn, we cannot always create new teaching pamphlets for patients. So most often teaching is going to be created at the lowest level of understanding so that everybody can gain information from what pamphlets or materials the hospital has invested in. Make sure you are providing evidence-based information. Current information is necessary so that patients are keeping current in their disease process and learning if there have been changes. Make sure you reference your sources at the end of your presentation as well. So formatting and designing your presentation. Again, remember this presentation, although it's being given to your classmates who are healthcare professionals, you are aiming at an target audience of patients. So you need to keep the presentation aimed at the patient level, using simple fonts, as I said before, bullet points, that minimal text, having flow to it. If you include illustrations, make sure the illustrations are relevant to the information that you're providing. Use your ability to design something that is attractive to the reader, easy for them to follow. Use arrows, have a nice flow, make sure the font is big enough. These are going to be the key principles we're looking for in what you're presenting. We want you to take the information you have learned and break it down into how you could educate your patient on the disease process. As I mentioned, this is a huge part of the learning or at nursing profession, providing education to patients. So we need to make sure that you are well versed at breaking information down and presenting it to your patient in a method that they are able to understand.